Welcome to today's presentation, everybody. We're going to be discussing the interplay between addiction and mental health and physical health. I just didn't want to make the title quite so long. Over the next 45 minutes or an hour, we're going to define co-occurring disorders, identify the impact of addiction on the individual, identify the impact of mood disorders on the individual, identify the impact of chronic illness or pain on the individual, and then explore the interplay between the three. Obviously, in this presentation, we're talking about the individual. We know that as a person's mental health or physical health decompensates, there will be effects in their relationships, and which will have kind of reverberating effects, but we just don't have time to cover all of that in this hour. So right now we really want to just look and understand the interplay and why it is so incredibly important to treat the co-occurring disorders concurrently, not prioritize and go, well, we'll treat this one, and then when that one's cured, we'll treat this one, and go down sort of a linear thing, which takes me to my next slide. Shout out to my Whovian friends. People assume that time is a strict progression of cause to effect. From a nonlinear, non-subjective point of view, it's more like a big ball of wibbly-wobbly, timey-wimey stuff. This is true about co-occurring disorders too. It's not linear. You can't say this caused this and then this caused this. They have reciprocal effects and they feed back in on each other. Why is that important? Because, well, it's important for a lot of reasons. Number one, the cool thing is if you pull one string, for example, sleep, which is one of my favorite things in the world, and you start improving people's sleep quality, whatever you have to do to improve that sleep quality is probably going to have positive effects in the other areas of